Good day, everyone. I hope you are enjoying the day. It's a beautiful, sunshiny day here where I am located. And today is Tuesday. It's time to do our NCLEX question of the day and for us to get another test tip. So it is Test Tip Tuesday. All right, here's our question. As you remember, I'm trying to pull some of those questions, those practice questions from the NCLEX package that you can kind of download from their site, from the NCSBN NCLEX Next Gen site. And some of those questions don't have answers, most of them don't. But we're going to tackle one today. And today we're going to do some maternity. All right. If you've studied with me before, then you know the first thing that we need to do is break down our case event. All right, we have a charge nurse, and the charge nurse has received a change of shift report on the following clients in labor. So everybody's in labor. We got 4 patients. The charge nurse should ask a staff member to first see the client in the blank 1, 2, 3, or 4. All right. So our query is a priority question, and we know that because they bolded first. And it's asking, who should we see first? Who should be seen first? Who should the charge nurse ask a staff member to go and see first? Everybody is in labor, but we do have a time proximity, and everybody is in a little bit different stage. 2 people are in the first stage of labor, and we have 2 who are in the second stage of labor. All right, so once you recognize that time proximity, now we got to figure out how are we going to differentiate the priority patient. Well, priority 9 times out of 10 deals with ABC, Maslow's, or ADPI, but they're asking for who should we see first. Seeing first is based upon a patient need, and patient needs are not within nursing interventions, which is ADPI. That's our plan of care. Patient needs are embedded in Maslow's. The top patient need is airway, breathing, and circulation. All right, so do we have anybody with an airway or breathing circulation problem? Well, we do have somebody who's breathing 26, so we're just going to kind of flag that one. We do have somebody who's having contractions, and we got one person who's having contractions every 30 seconds, which is another time proximity, and we have another person having contractions that are lasting 60 seconds. So time proximity plays a part, how long it's lasting, and contractions are a part of circulation, because every time that mother is having a contraction, the baby's heart rate is usually going to dip down. It's going to decelerate, and then it's going to recover. Normally it should recover and come back up to its baseline heart rate. So the baby doesn't really get a good blood supply every time that mother's having contractions. So you want to see how often are they able to recover, and how is the baby tolerating those contractions. Is the contractions too much, where the baby may not be getting enough blood flow during the time? We also have someone with a temperature, but the temperature isn't terribly high. It's a little bit of a fever, kind of low grade, 99.7. All right, so we got all having some key things. Now we have to differentiate, is this an ABC issue? But there's also other ways to prioritize. Other ways to prioritize. And this one may not totally be an airway, breathing, circulation problem, because nothing really big stands out unless you're saying, this breathing is off. But we also have to remember that this patient is in labor, and we have to look at the stages of labor that they are in. All right, some other ways to prioritize. You want to think about who is, like we said, having an ABC problem. Is there a medical emergency? Think about Maslow's hierarchy of needs, but also think of what's expected versus unexpected. And especially when you have time proximities, like different stages of labor, what should be expected in each of those stages of labor? What could be signifying a problem, an urgent need, and what is expected versus unexpected? All right, we're going to come back to that. All right, so we're going to talk about the answer, but first, I just want to congratulate and celebrate anyone out here who is a nurse, or if you know a nurse who is a certified nurse in whatever certification. There's so many certifications. The AACN is a American Association of Critical Care Nurses Certification Corporation, but there's also med surg certification, stroke certification, surgical certifications. There's all these different types of certifications that nurses can receive. So did you know today is Happy Certified Nurses Day for 2024? So celebrate champions of excellence. I want to thank and thank you for your commitment. And I have been certified for 5 years now, since 2019. 19, 21, 2, 3, 4. Yeah, 24. I'm trying to think, how many years has it been? It's been 5 years. I've been certified for 5 years. I have a CCRN certification, which means I am certified as a critical care registered nurse in adult CCRN. Don't work with babies, but I work with adults. All right, so thank you to your commitment to earning and maintaining your certification. You contribute specialized knowledge to patient, families, and healthcare professions. This is coming from the AACN. If you are a member, I am a member of the AACN. As a result of your dedication to continual learning, you inspire others to achieve more in their professional careers. You are a champion of excellence. So happy Certified Nurses Day to you and other certified nurses everywhere. Or if you know a certified nurse, this is the Lippincott Nursing Center. You can go to nursingcenter.com. There's a nursing certification review courses that are available on this site. So there's critical care, there's emergency, medical, med-surg, there's neonatal nurses, there's obstetrician, oncology, peds, perioperative, just about psych nurses, just about any level of a line of a specialty of nursing, there is a certification for it. Also, for Certified Nurses Day, for critical care nurses out there, there's a video, Happy Certified Nurses Day 2024. That's on YouTube. Thank you for going the extra mile to becoming a certified nurse. Make the most of your Certified Nurses Day. They do give some things that you can print out. There's commemorative posters, some stickers. There's a thank you card if you have anyone you would like to thank and give, or take it to your unit and just thank the nurses who are certified, who are taking care of those patients and just doing such an excellent job. Celebrate certified nurses. There's also a post for social media release. There's some gifts or a gift certificate that can be purchased. A lot of good things for our certified nurses. All right, so getting back to our question, let's get into the answer of how we're going to break this down. All right, so we talked about priority could be ABC. Is anybody at a risk of loss of life? And we also talked about time proximity, focus on the present, focus on the time frame that these patients are in their stages of labor, and how often these two people are having contractions. And we also want to prioritize based upon what's expected versus unexpected. Is this an expected effect or unexpected effect? I already said thank you because we're almost to the end. So I'm thanking you ahead of time. All right, let's go back. So we're going to break down each of these stages and figure out what's expected or unexpected. Well, the first patient is in the first stage of labor, and they have a temperature of 99.7. Not too terrible of a fever if you're thinking fever or infection. First stage of labor, yes, your body's going through all these changes. It's just a response of the body. May not be that significant, 37.6 Celsius. So if we look at just Googling, if you want to do a little Googling, sometimes that helps, sometimes it doesn't. But probably even looking at a maternity textbook, they may say that a raised temperature could be expected, but it may indicate infection or other complications. So here they give an example that it's 37.5 or 99.5 above that. So they're just what, 1/10 of a degree above. May not be that significant. It also could be a part, and I thought I clipped that in here, but it also could just be a part of their going through this stage, first stage of pregnancy, of the labor. So we want to keep it in mind, but remember, it's not very significant. It's not far off from a normal temp. So this may be more expected. Let's get rid of that one. All right. I'm looking at these airway and breathing and circulation issues. All right. So contractions have to do with circulation. One patient, patient option 2, it's in the first stage of labor whose contractions are occurring every 30 seconds. Now, when you go back and review what the first stage of labor is, that is the stage that has 3 phases. There's a latent phase, the stage of dilation, basically. There's an active phase where she's further dilating, and then there's this transition phase where she's pretty much all the way dilated and she's about to transition to the point of having that baby. All right, in the latent phase, and we don't know which phase of the first stage this patient is in, but the contractions are going to start out mild, infrequent, gradually increase to moderate intensity, and they may be about every 5 minutes. Once they get into the active phase, those contractions are going to intensify until there are about 3 minutes apart. Now, how long they're lasting is the duration. They're lasting for 45 seconds or longer. They're becoming more and more intense, moderate to firm. By the time they're just an hour before having that baby in the transition phase, the cervix is going to dilate even more and their contractions are going to be more firm, 2 to 3 minutes apart. So from one contraction to the next, one contraction happens, 2 minutes later, another contraction, or possibly 3 minutes later, another contraction. So they're 2 to 3 minutes apart. Now they're going to last as long as 90 seconds, which is about a minute and a half, versus 45 seconds in the active phase. So when we go back to that patient, this patient was having contractions. They're in the first stage of labor. They're having contractions every 30 seconds. Whoa. But how far apart? How often are they occurring? They should occur usually at a max of every 2 to 3 minutes. So that mother should have about 2 to 3 minutes in between each contraction where she can rest, relax, recuperate, and that contraction, the uterus relaxes and it allows blood flow to get to the baby. But every 30 seconds, she's having like 30 seconds in between to recuperate. Those 30 seconds are probably going by just like that. I'm sure 2 to 3 minutes goes by fast. This is unexpected. We're going to put a big U there. We're going to keep this one. Going to put a star. All right. Option 3, second stage of labor who has respirations of 26. Now, 26, it's dealing with airway and breathing, but is that expected or unexpected? They are delivering a baby. This person is not in the first stage, but in the second stage. When we look at the second stage of labor, that's the stage of expulsion. The baby is coming out. Yes, they're going to have some pain. Are people in pain breathing fast? Yes, they are. So this person's fully dilated. Um, Average second stage can be as long as 50 minutes, 20 minutes if they've had multiple babies. It's going to vary among women. They're going to feel a lot of rectal pressure, this urge to push. Contractions are still intense, maybe slightly less so than in the transition phase, but they're still having pain, and now they're having this urge to push. Yes, I would expect this mother is going to be breathing slightly fast, 6 times more than the normal, right? At the max, 18 or 20 times per minute each breath, but she's breathing 26 breaths per minute. But she's pushing. This is the final preparation for birth. The crowning of the fetal head. So the second stage is the stage of expulsion. I bet that this is going to be expected. Even though it looks like it's abnormal, remember, they're having a baby. So adult respirations, 12 to 18. Yeah, 20 is not too terrible. She's up to 26, but she's in pain and she's birthing a baby, and she's in the second stage. All right, we look at the last one, second stage of labor whose contractions are lasting 60 seconds. So we're down to the last 2. We're going to eliminate 3. That was expected. Is option 4 expected or unexpected? Well, we need to think about that second stage of labor again and how long are her contractions going to be lasting. This one says 60 seconds. All right, so remember, This one was occurring every 30 seconds. This one is lasting for 60 seconds. So we already said, and I put it in the wrong area earlier, but we already said that contractions at the max usually last up to 90 seconds. And that was at the end of the first stage, which was the transition phase, which can carry over and go into that second stage of labor, the stage of expulsion. So max is 90 seconds duration. This is the duration. This is how long um, each contraction is lasting. All right, so her contractions are lasting for 60 seconds. All right, so they're not lasting quite as long. They're lasting shorter, and we're going to see them intensify, but I don't want it to last longer than 90 seconds. But if it's lasting 60 seconds, it's lasting for about a minute, right? The max is a minute and a half. All right, so as we saw here, now this was the end of the first stage. The second stage, again, dilated, but she's pushing, and contractions are still intense, maybe slightly less than the transition phase. So it can drop down a little bit instead of being up to that 90 seconds. Yeah, it may last about a minute. So this is 1 minute. It's under the max. It is expected that it might drop down a little bit, but it's not over, and that's where it would be concerning. So we can get rid of that. We're going to say it's expected. So we're left with one option that is unexpected. These contractions are occurring too frequently. They're not far apart enough. They're not giving any let up or any space in between. So yeah, this one we need to see first. Contractions every 30 seconds. My goodness, that's got to be rough. So the charge nurse should ask a staff member to first see the patient in the first stage of labor whose contractions are occurring every 30 seconds. Contractions should be up to at a max of probably every 2 to 3 minutes, not every 30 seconds. All right, did you get that question right today? Did you get it correct? If you didn't, when you're looking for a patient to see first, go ahead and categorize those who are expected, having some conditions and symptoms of their expected process, procedure, or disease, or whatever's going on. Like in this case, these patients were having babies, and categorize it. What's expected? What's unexpected? That's one good way to prioritize who to see first. All right, this has been your NCLEX tip of the day. It is Tuesday, NCLEX test tip Tuesday, who to see first, how to prioritize those patients. And so I hope that helps. Have a wonderful, wonderful day, and happy Certified Nurses Day again to anyone who is certified. Happy Certified Nurses Day. Hope you all have a wonderful day, and I hope this test tip has helped. Enjoy the rest of your day.